We are presenting our challenges in nursing paper today, and our topic is patient obesity. My name is Kim Murray.
I'm Paula Black.
Obesity is a disorder that affects all groups of people. In America, the incidence of obesity continues to rise every year. From 1976 to 2000, obesity rates increased from 14% to 30.9%. Today, it is estimated that more than 67% of adults are overweight. The patient's physical size can complicate even the most basic nursing interventions. For instance, skin care, respiratory challenges, assessment and resuscitation measures, altered drug absorption, intravenous access, and immobility can pose nursing concerns and are just some of the areas in which nurses will experience challenges in caring for the obese patient. The areas we will be focusing on are decreasing negative stereotypes that influence the nurse's perception of the client, blood pressure measurements which can be encumbered due to patient size, and skin integrity which can be diminished because of the skin folds of an obese client. Nurses will face many challenges in the healthcare field, but one that is gaining momentum due to the increased sedentary lifestyle of our modern society is obesity. Nurses that have an obese client will have to learn to deal not only with the challenges of the patient's size, but also discovering their own stereotypes that could affect the care the client will receive. With regards to negative stereotypes the nurse can have about the patient's size, if the nurse goes into a patient's room with a perceived attitude about body size, then that mold that he or she has placed every client into will influence his or her attitude and treatment of an obese client. The rise in obesity rates and ineffective management is that weight has become a sensitive topic to address, and clients who experience obesity often feel marginalized and misunderstood. If a nurse does not fully understand how a patient might feel about health care, the nurse's treatment of the patient can create an unpleasant memory for the client when remembering their past health care visits. Therefore, a nurse must approach obese clients without a negative attitude, because a nurse's attitude could further impede the obese patient from seeking medical attention. A nurse must have an understanding on how to decrease stereotypes of an obese client, but he or she must know how to act to care for the client. One way to accomplish this is by developing interpersonal relationships between healthcare providers and clients, which are the most important and integral to managing these obese patients. For instance, experienced nurses could mentor younger nurses and provide workshops within the hospital atmosphere to assist in a novice nurse learning how to approach a patient with an objective, non-judgmental approach. Once the novice nurse has developed a relationship with the client, he or she would be less likely to treat them without dignity and respect. The nurse can also use a feminist structuralism approach towards dealing with obese clients in order to understand that obesity is a disease. A feminist approach can help the nurse and client understand the interactions that take place, in turn benefiting the relationship built with the patient, focusing on experience and feelings, which will also help to give an understanding of how power relations are complex and affect the practices of nurses and clients in this context. The nurse is able to build a supportive personal connection with the patient, helping the care the client will receive. The nurse must show empathy and compassion to the obese patient as he or she would to any other patient, while making sure their facial expressions remain objective rather than subjective. Another challenge that is present due to the large size of the patient is a simple step in taking blood pressure can be encumbered due to the increased size of the client's arm. What is the best way to measure blood pressure in obese patients? If the cuff size does not fit the patient's arm, should I use a larger cuff or just use a standard cuff on the patient's forearm? Which method is the most accurate? If the nurse faced with this challenge is a novice, he or she might have an increased complication due to lack of experience and understanding on how to deal with the issue, because arms of an obese person are no longer than arms of a non-obese person of similar height, but much larger in diameter. Due to this discrepancy, following the standard for selecting cuff size results in poor fit. People who are obese also have arms that are shaped like an inverted cone, both of which adds to difficulty in finding the right sized cuff. The nurse must have a greater difficulty in completing this normally simple task. Overcoming the challenge of blood pressure measurement can be somewhat complex. There are many measures, such as ensuring that a hospital or clinic has many cuff sizes available, holding the patient's arm at heart level, and measuring the blood pressure in both arms of the patient. An accurate measurement of the obese patient's blood pressure is possible without demoralizing the patient. Nurses need to be sensitive to vital sign measurement and thoughtfully choose another site, such as the forearm, for blood pressure measurements. Again, workshops, videos, and experienced nurses assisting the novice will also help in measuring blood pressure in the obese patient, preventing the barrier from overcoming.
The next barrier to discuss is skin folds, which can cause skin breakdown in obese clients. Skin breakdowns can create intertrigo due to friction between skin surfaces. Intertrigo usually presents as mild arrhythmia. Frequent sites of intertrigo are skin folds in areas that retain heat and moisture, such as the posterior neck, axilla, under the breast, under the peniس, the perineal area, and the inner thighs. More severe intertrigo shows signs of inflammation, maceration, and erosion. As a result, secondary infections can develop in obese clients simply from skin fold friction. The warm environment between the skin folds also allows for microbes to set up residence. To overcome the barrier and prevent skin breakdown in obese clients, it is important for nurses to be proactive in order to prevent problems associated with skin breakdown. One way nurses can be proactive is to reposition the client every 2 hours. Nurses can also assess catheters, tubes, and skin folds, and dry between folds as needed by using cornstarch, skin sealant, or protective ointment, and also by applying soft blankets to line skin folds. Nurses should also keep sheets wrinkle-free. In this manner, nurses can help prevent skin problems associated with an obese client. In order for a nurse to illustrate professional involvement in obese patients, he or she can become an advocate who empowers his or her client to take control of their health care. Empowerment is when individual people are encouraged to assert their autonomy and self-sufficiency in order to identify their own health agendas, rather than being told what to do. As a result, nurses become a professional advocate on behalf of their patients, explaining the health process to the patient, which allows the patient to fully understand the health process that will be occurring. Once understanding occurs, patients can assert some control over their own health care. Consequently, the nurse no longer has to try and figure out how to take a blood pressure reading on an obese patient. Instead, the patient can say where the reading can take place in a manner comfortable to him or her. Thusly, nurses take on the role of professional or expert by empowering patients to have autonomy of their own health care. In conclusion, obese patients will present many challenges to nurse care. The 3 previously discussed are negative stereotypes about body image that affect the nurse's treatment of an obese patient, how patient size can influence blood pressure readings, and patient obesity can cause skin integrity to be more difficult to maintain due to skin folds. The nurse can overcome these barriers through videos, workshops, and involvement of more experienced nurses mentoring the novice nurse. Nurses can also empower their patients, allowing the patients to become more involved in the care they will receive, which in turn improves the relationship between nurses and patients.